We will start with washing our hands thoroughly till the soap makes some bubbles. Make sure to scrub and rub thoroughly to the nails, in between the fingers. It's important to wash thoroughly and rinse. Now we grab a napkin to shut the water off. Always with a napkin, never touching the handle. We have a dispenser, as you can see, which makes it a lot easier to dry our hands without having to touch anything else and keeping our hands nice and clean and sterile at all times. Now we go ahead and put our hand sanitizer on, and then we will glove up. We make sure to do this thoroughly as well. I do all the cleaning and everything since Jackie is unable to see still. I make sure to clean thoroughly so she's unable to do it. She is bleached. The patients are bleached. What that means is that they're able to clean without putting gloves on, but since I'm not the patient, I have to put gloves on for every step. Now we're going to use Clorox wipes. You can also create a mixture between Clorox and water. Your clinic can tell you the ratio for that. But we use Clorox wipes. We were told that was okay to do. So I clean the machine thoroughly with the Clorox wipes. Cleaning the top, the sides, all around. Now cleaning the inside. Make sure that it's cleaned thoroughly. Once we get to the center, we'll be careful not to put a lot of pressure in the center, but making sure that it's cleaned out thoroughly. Next, we clean the countertop. We'll clean the countertop thoroughly. I will pick up the machine to clean under it and move it to the side to clean all the way around, all the way under the machine. Next, we clean the cabinet where we store everything, the immobilies, 2x2s, everything we need to connect Jackie. Making sure everything's cleaned thoroughly. Our nurse trained us very well. Our nurse Linda's amazing. She made sure to let us know how to clean and to keep everything clean to prevent any infections. We've been doing this for over a year and a half and no infections whatsoever. We always make sure everything is nice and clean and sanitized, especially cleaning right before we connect. Clean the accept, clean everything. And this is done on a daily basis. Now that that's done, we go and wash our hands again. So through every step, we wash our hands. And we wash our hands a lot, so I wash my hands a lot. And my hands break, so as you can see, we follow the same steps. There's going to be a portion here right towards the end where I was instructed that it was okay just to cut one of those back and only hand sanitize because I wasn't touching anything else, and that makes it safe. But you always consult your nurse and your doctor. Don't take my word for it. We are instructed based on, situation, person-to-person basis. Now we press start. We connect to network. Now we put in the weight, which was taken on earlier. Enter. Now ounces. Now enter. Now we go down, arrow down, put in the blood pressure, enter. First set of the blood pressure. Now enter and the second part of the blood pressure. Enter, stop. Please wait. Now we press go. Now we can load the set. We bring out the cassette. We open the bag. Once we bring out the cassette, we will close all the clamps, making sure that all the clamps are closed. And there's 5 clamps. There will be 3 white, 1 red, and 1 blue. So making sure that all clamps are closed thoroughly. Next, we will insert the cassette. And we will make sure that the cassette is inserted properly. There is 4 little grooves in there, 4 little parts in which you have to make sure it's in evenly all the way. And the drain lines, or the lines, come through an opening on the side, never touching the center. You don't want to damage that cassette. You close it up, take off the blue tape, and up on top has a little groove. I call it the little smile. So I put the smile in, and then goes in the nose. That little bump right there. Then we straighten out the lines because we don't want them to tangle. Next is the drain line. The drain line runs to either a sink, a drain, in our case in a little bucket, since we don't have a drain that we can run it to. We're able to use a bucket. Now we press green, which is go. Now it's self-testing, and as a self-test, we are going to get the bags ready. Today we are doing yellow. Since Jackie was a little underweight, we were able to do yellow today. You'll learn through your clinic. Sometimes you'll use yellow, sometimes you'll use green, green, or even red, depending on how much water retention you have. And if you have a lot of edema, that's a lot of water retention. So you learn through your clinic. Now we open up bags. Right before that, I washed my hands right now and came back. Now I'm going to clean the bags. Since there's condensation inside of the bags, you make sure that there isn't any water. Clean it thoroughly, making sure that there aren't any leaks, that the condensation is not really a leak, so we have to make sure. And as you can see, there's some liquid that was wet. Always making sure that it's not expired. Never, ever use an expired bag. Checking a bag thoroughly, making sure there aren't any items inside. Now the first bag, we put it on the top as it heats it up. Nice and clear, nice and clean. Second bag goes on the bottom, and it'll cycle through, so it'll warm up on top. Now we take our gloves off, where I mentioned earlier, since I haven't touched anything else and I wash my hands, now I get to hand sanitize. Now that I put gloves on, we're going to connect red to hot. Red means hot, so red gets connected to the hot right on top. So that's red to hot. Making sure it's nice and tight. Red connected to the top, which is hot. Now we break, making sure it's open thoroughly and there aren't any leaks. Open clamp, bring it down. Now we are going to move on to the white, which is the next line. That'll connect to cold to the bottom line. Once Jackie's dialysing, it will cycle onto the top and it'll keep it warm on top of the cycler. Nice and tight. Checking for leaks. White to cold. That's the second line, so white to cold. Well, the second line after, the line after the red, which would be the third line actually. First is the drain, then the red, then the white. This is what it looks like. nice break. No leaks, nice and tight. Open clamp, bring it down. Next one is the blue one. That's the Toxic X. We don't use the Toxic X. Jackie doesn't need it. Never talk to it. Never look at it. We don't use it. Some people might need it. In our case, she doesn't. The next one is the fill line. That's what we'll go into, Jackie. We open clamp, bring it down. Make sure the line is on correctly. And then we're going to start priming now. Press green, which means go. Connected bags, open clamps. Now it's priming. Now we check to make sure it primed all the way. This is how we check. Making sure it's primed all the way. There isn't any gap. You do not want to connect to your patient if they have a gap because it will hurt a lot. So always check with your clinic, check your leaks. Any questions, always ask your nurse, ask your doctor. Make sure that everything always looks good. And this is how we connect the bags. And ready to connect to Jackie.